With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.
Good afternoon, and thanks for joining me and State Health Officer Dr. Jimmy Guidry and Assistant Secretary for the Office of Public Health, Dr. Alex Bu, and Interim Health Secretary Stephen Russo. Today, the Louisiana Department of Health confirmed the first presumptive positive case of COVID-19, commonly called coronavirus, in the state of Louisiana. The patient is a resident of Jefferson Parish and is currently hospitalized in Orleans Parish. In order to protect the patient's privacy, we will not be releasing additional details about that case. We've done 15 tests total. 14 of those have come back negative, this obviously being the only one that came back positive. The next step, and when it's underway, is for the presumptive positive test to be sent to the CDC for confirmation. This confirmation may take up to a few days to occur, but we are confident in the result of our test, so we're treating this situation as we would a confirmed positive result. Keeping the individual in isolation, interviewing those who came in close contact with them to assess their risk, and assessing what other precautions should be taken in the local area to reduce the spread of illness. We've been preparing for this moment for many weeks because we felt certain this day would come based on the information that we've been getting from the CDC and from our partners in Washington, D.C. I'd like to briefly speak about the coronavirus testing because I know that there has been some concern about who should be tested. Currently, Louisiana has several testing kits from the CDC in our state lab with which we can do several hundred tests as needed. We are confident the CDC will give us additional testing kits as needed as we move forward. This morning, I was on a conference call with Vice President Mike Pence and other health and state leaders, and we were told that commercial testing will go live across the country and in Louisiana this week. This is important because testing capacity is a concern for all states. Commercial testing means that more people who are sick will be able to talk to their health care providers about their risk and if they need to be tested, and certainly that is a good thing. Our role at the state will be to take any test that is presumed positive by a commercial lab, to verify it at the state public health lab before sending it to the CDC for confirmation. The verification will be important as these commercial tests come online. We have the capability to test hundreds of people, and it will only increase with the CDC providing more tests and with more commercial testing coming online. That said, you will begin to see the testing number go up for two natural reasons. First, we will conduct an epidemiological investigation of this presumptive positive case to determine the risk to the patient's family, friends, and those that they may have come in contact with. Some of these people may be tested based on their risk factors. Second, the state of Louisiana recently expanded its testing protocols to include a broader group of people. This means that if you have traveled to a country or region of concern or come in close contact with someone who has COVID-19 and are showing signs or symptoms of illness, and you have a negative flu test, you can be tested for COVID-19 here in Louisiana. At all times, our testing protocols have mirrored those of the CDC, and at no time have we not tested anyone who met those guidelines. To put this in context, the CDC reports at least 35 states, including D.C., have cases of coronavirus. Understand that the case in Louisiana has not been officially included in the CDC reporting as of yet because it has yet to be confirmed by the CDC. Close to 600 cases have been confirmed across the United States of America. Right now, the risk is still low for spread here in Louisiana and in the United States. We are obviously taking this seriously, and we've been preparing for this for many weeks. Last week, I held a unified command group meeting and created a COVID-19 task force to lead the planning for different scenarios as COVID-19 was spreading across the country and would almost certainly come to Louisiana. Our agencies are communicating with federal officials and with each other to ensure that we're doing everything we can to prevent the spread of illness. And certainly we need the people of Louisiana to be vigilant as well. The public is encouraged to wash your hands frequently and well, to make sure that you control your cough into your elbow, to disinfect frequently, use surfaces, and to avoid close contact with people who are ill. And if you are sick, please avoid going out in public, stay home from work or school. This will help us tremendously to prevent the spread of illness. The most important thing the people of Louisiana can do today is listen to the advice of public health officials. One thing that the Vice President and federal officials asked us to stress is that our senior citizens and those with chronic health conditions need to take extra precautions to protect themselves and be certain to avoid contact with people who are sick. And these precautions naturally extend to every person who lives in households with these individuals who are especially vulnerable, meaning in households with senior citizens and those who have these underlying health conditions. So I want to reiterate, we've been preparing this for several weeks. Now is the time to rely upon the best available information as it is made available to you, to take every precaution that has been suggested to you, and to take this seriously. So with that, I'm going to pause and take your questions, many of which I'm sure will be answered by the subject matter experts who are up here with me today. Yes, ma'am.
Cassie Sherman, News 15. So in Acadiana, we have Festival International, and I was curious about on y'all's radar on possibly closing that or not doing that this year with this virus.
Well, that specific event is not on our radar, although we are watching what's happening in other states. We don't currently have a CDC recommendation that relates to canceling events. We are in consultation with local officials and organizers of these activities and these events, and these are some of the things that we're going to be deciding over the next several days and potentially over the next few weeks as this situation further develops. Yes, ma'am.
The age of the victim and any idea about contacts you might have had in Jefferson Parish?
Okay, I'm going to go back to what I said. I've announced all the details about this case that I'm going to announce.
Are you able to tell us how many people may have been in contact with this individual? And
what I can tell you is we are actively doing that epidemiological investigation to determine that information. And then with that information, we will then be making sure that any individual who needs attention or screening or testing, that becomes available to them.
in some schools, or in some states, schools have been impacted. Is that something that you foresee being a possibility?
Well, certainly anything right now is a possibility. I don't want to sit up here and sort of guess at what may happen. We are working every day with our federal partners at the CDC, but also with other states, some of whom have already had a case or multiple cases of this novel coronavirus, and we're trying to see what they've done that works and what potentially doesn't work. And as we have more information related to potential impact of schools, we'll let you know. I will tell you this, if you go to coronavirus.gov, there's a series of recommendations all built around mitigation of the coronavirus, and you can access recommendations for households, for businesses, for schools, and other entities. And I'm encouraging everyone to go out and do that.
In some states, some lawmakers have voiced concern about the economic impact that this could bring to the state. What are your thoughts on that?
Well, obviously it's far too early to speak with any specificity on that. There will be an impact. It will be adverse. That much we know. We don't know right now exactly what that's going to look like. I will tell you it's more important than ever that we take the time to look at the modeling that is given to us by economists who are experts, and then make our decisions based upon their very best guidance for us. And that's really the process that we have in place through the Revenue Estimating Conference, and that's what's going to play out. It'll meet in, I'm not exactly sure when, but in a few weeks. We have some time before we have to have a revenue estimate to inform our budget process, because it'll be some time before that budget bill starts to move. And we're going to do everything we can to strike the right balance between getting that information as soon as possible, but also getting the most accurate information so that we can base our budget on it. Yes, sir.
Governor, you said the state has tested 15 people as of today. Do you know how many have requested tests?
I don't know how many have requested tests. I know we've tested everyone who met the testing protocol that mirrored the CDC recommendations, which is what we were doing in Louisiana. I'm not aware of a single instance where we have refused a test. Looking over at Dr. Bayou.
That met guidelines.
Yeah. Yes, sir. Yeah.
Without compromising patient privacy, can you say whether he or she had traveled abroad recently or was traveling out of state?
You know, this test result came positive, I think, at noon today. And the investigation is ongoing. And there's some things that I'm not going to share with you because of trying to protect the patient's privacy. Other things I'm not going to share because I would be guessing, and I'm just not going to do it. And so as we have more information that is appropriate to share, we will do that. Yes, sir.
Yeah, going back to what you said about the REC. So internally, are y'all thinking about making any changes to your budget proposal, either because of potential economic impacts from this or from what we're seeing in the oil markets?
Yeah. Well, we're not, you know, the oil market turned over the weekend, right, and today. And so we're not further along than you probably think we are on that. But obviously we will be talking to economists, including the economist who works at the Legislative Fiscal Office and the economist who works at the division. And those are the two opinions that inform the REC about the forecast that ultimately gets adopted. And then once we have a better picture, we will then have a series of recommendations that we will work with the legislature, and I suspect this will be a topic of frequent conversation between myself and the Speaker and the President over the coming weeks. It is just too soon right now to really speculate as to what this impact is going to be. I mean, we know it's not going to be positive, but we don't know exactly what it's going to look like, and so I just don't want to engage in that kind of speculation right now. But it is a good thing that we have the REC process that we have, because we rely on economists to tell us what we can expect, and then we budget based upon those expectations. Yes, ma'am.
When you say it's here, immediately people start to think, okay, it's here, you know, panic. How do you stop the panic from people in Jefferson Parish who are thinking now, oh my gosh, somehow I'm going to get panic?
Yeah. Well, first of all, it would be my hope that we try not to even use the word, but it's counterproductive. It doesn't help. What people need to do is take stock of the situation, take it seriously, but understand that these precautions are very, very effective at limiting the spread of this virus. And they're the same precautions that ought to be second nature to everybody anyway, because they help us with respect to the flu, which in any given year, 2 years ago, it was 61,000 people who died of the flu. This year, 48,000 or something like that who died from the flu. And that is not to minimize what the situation here is with coronavirus, but just to let people know that we don't panic every time there's a flu outbreak. We take it seriously. When there is a vaccination, you should get it. And until that happens, you wash your hands. You avoid contact with certain people unnecessarily, the handshakes and so forth. Cough into your elbow and don't go to work when you're sick. That's what we need to be doing. And individuals, and once we do this investigation, because I know your question was specifically about this individual from Jefferson Parish, once we do this investigation, we're gonna know who we need to go talk to. And then they're going to have every opportunity to be evaluated and so forth. So it is just, you mentioned the word panic. That is never the right thing to do. And that's certainly in the case right now, I know. Yes, ma'am.
Governor, in terms of the conversation with the Vice President, did he give any sort of broad outlines of travel and what he thought was sort of the best guidance and what was most appropriate for people, whether that's avoid cruise ships or try to avoid plane flighting?
Yeah, well,
That level of specificity?
not from the Vice President himself. He did have people available on the call, Dr. Tony Fauci, for example, who specifically talked about travel. And in consultation with our public health experts here in Louisiana, I will echo what we were told, which is no different than what they started saying over the weekend. Older people and those individuals with these chronic health conditions, with compromised health, they should only take a flight if absolutely necessary and should not under any circumstances go on a cruise right now. And so that's what's coming from Dr. Fauci, and that's what's coming from Washington, and that's what we're going to echo here. As it relates to travel more broadly, the Centers for Disease Control, working with the Secretary of State, the Department of State, they're continuously upgrading which countries are Tier 1, Tier 2, Tier 3 countries. And then as that list changes, then obviously where people should and shouldn't travel will change, and then what the protocols related to testing individuals who may come to our country from those countries will also change. But I would encourage everybody to pay attention to what the Department of State and the CDC is saying about these countries, because I don't know that anybody, first of all, you don't want to go and unnecessarily expose yourself to this virus. Secondly, if you don't have the virus, you don't want to come back and spend 14 days in isolation.
Did it come from the VA Medical Center? And what sort of precautions are they taking specifically at the VA?
I'm not going to say anything more about this particular case that we announced today. Yes, sir.
I understand a couple of nursing homes on their own have told patients they need to stay inside and restricted access from visitors.
Yeah.
Is this a directive from the state, and if not, is it an appropriate directive?
Well, it's a directive that the nursing homes are taking on their own at this point, but it's based upon information that they are getting probably from the State Nursing Home Association and from the National Association. And these are healthcare providers. In light of the fact that we know it is the elderly population most at risk from coronavirus, the novel coronavirus, COVID-19, and those with underlying serious health conditions, those are the people who populate nursing homes. Then you can expect that they will have more precautions in place, and that those may evolve over time. And I'm not going to second guess them here. I will tell you that later this afternoon, we're going to have representatives of all of the major healthcare stakeholders here to have conversations with them. So it'll be hospitals, nursing homes, those sorts of folks, and we may learn more about precautions that they're putting into place now. Sam?
Governor, can you talk more about exactly what happens with this patient and the people they come into contact with, the people, their family and friends that they've interacted with, going to be put in quarantine? If so, how long, where, how does that work?
Okay, I'm going to ask Dr. Bu or Dr. Guidry to come up. I know the words epidemiological investigation. I think I know what that means, but I probably am not the best person to answer the question.
Yeah, so actually, exactly as the governor said, what the team is doing right now is trying to find out who those individuals are that need to take other precautions. Anybody who's been in contact with that case would be treated like somebody who's been to a country that has spread of COVID-19, and that means those recommendations we've been making now for a while, stay home, monitor for symptoms, that would now apply to them. And we'll be communicating all that to those individuals, as the governor said, who need to know that information.
And that would still be a voluntary self-isolation type thing where you guys ask them to
That's right.
isolate for 14 days?
So far, we've had nobody disagree with that.
Yes, sir.
It would be 14 days, right? That's the
Yeah, currently it's 14 days. That's the guidance that we're continuing to follow, that other jurisdictions are using across the country.
Governor, is the state concerned at all with large gatherings of people? Is that something the task force is evaluating?
It is something that the task force is evaluating. The task force meets tomorrow, and following that meeting, I will have the benefit of a new series of recommendations that will come forth. And they will be looking at things like travel, for example, by state employees. They're going to be looking at things like events and so forth. And even if it's not advisable now to curtail some of those activities, we probably ought to go ahead and determine what factors we're going to look at in order to know when it does become advisable, so that we're making the best decision that we can make on a timely basis and getting out in front of all these things. But those are things that I expect to hear from the task force tomorrow, among other things. Yes, sir.
How many people in Louisiana have been asked to self-isolate after traveling to a level 3 country or another place affected by the
Yeah, I'm going to ask Alex.
So I don't have that number off the top of my head, but we can certainly get that for you.
I know that as of about a week ago, it was about 3 dozen or so individuals. And then you have some groups that have traveled, whether they're church groups or school groups, and they've decided to do some things on their own, but that aren't necessarily being recommended by us. And so we don't have one single answer to give you on that particular question. Look.
How many test kits or tests in general do you have currently on right now?
That we are, I'm sorry, ask your question again. I didn't understand it.
So there's hundreds of test kits or
Yes.
ways to test. What's the specific number that you have currently?
Well, we were given 1,000 test kits initially, and then this past week we got 2 test kits of 500 each. And so that's 2,000 test kits. Now, that doesn't mean we can test 2,000 people because it takes 3 to 4 kits per person. And then once you test for an individual or other individuals, the kits related to that particular plate are no longer usable. Did I get that somewhat right?
Yeah, essentially, it depends on how many samples we run at a time, how far we can go. But as the governor said, hundreds.
And that's why the easiest way to communicate that is we're telling people how many individuals can be tested right now. And that's why that's the number that I gave you earlier.
But that's not raising the question that we could have a problem with testing.
No, well, I don't believe we will. We have several hundred that we can test now. And then the commercial testing is coming online this week. And so we don't believe, and by the way, as the commercial testing comes online, you're going to see expanded protocols as well. And so you're going to see more people who ultimately are tested. Yes, sir.
Do you know which commercial labs in Louisiana are opening, exactly where they are, and whether they're being provided more kits by the federal government?
No, they are. Yeah, and that's one of the things that the Vice President and the folks are on the phone today, and I don't remember who it was that gave us our testing. Oh, it was Dr. Burks, Dr. Deborah Burks. She gave us an update today about the testing that will become available through these commercial entities starting this week. And because what they're looking at is being able to do a lot of high volume throughput. And as you can imagine, when you look at the states around the country that have had the most cases, that's where they're going to focus first. So but they're getting these test kits out all over the country. And so this commercial testing is going to be much more available. And it will work, I think, for the patient. It will look just like any time that they go and the doctor orders blood to be drawn to be tested for whatever, in whatever condition. That's the way this is going to work going forward.
Do you know which specific labs in Louisiana might do this?
Well, do you have that information?
Yeah, so LabCorp should be able to do this testing, and we're told by Quest in the next 2 weeks they should also be able to do this testing.
Yes, ma'am.
Are there any measures being taken at the airports in New Orleans, large travel airports?
Yeah. Well, those measures were actually taken several weeks ago. And so as individuals travel into the country from these countries of interest, they are being routed into certain airports, and then they are being screened. If from there is a passenger who should be of interest to us, that gets communicated to Louisiana from the federal government, and then we pay attention to those individuals who are here. But that's actually been taking place for some time. Yes, sir?
As community spread is increasing within the United States, though, is there going to be an effort to increase testing at airports for domestic travel?
I'm not aware of any additional testing at airports for domestic travel. The testing protocols are, as I've mentioned them, every time the CDC revises their guidelines, we revise what we do.
We've got one case, but generally after that, you hear about more. How will you continue to get the information out?
Yeah.
Are you doing a press conference every
Yeah.
day? It will be something that's...
Well, what I can tell you is for every presumptive positive test, you will hear directly from the state, either myself or the Department of Public Health at Louisiana Department of Health. I don't know that we're going to do a press conference every single time. I can imagine, however, that periodically we are going to have a need to do a press conference so that we can share new information and give you all an opportunity to ask questions. And we will figure that part of it out as we go. But we're going to be issuing statements. And again, if you look at social media, it's full of a lot of folks out there saying things that are just not true. And that's why I made it a very big point with us. We're going to be very transparent, we're going to be very timely, and we're going to be factual, and we're going to tell people when we have a positive case in Louisiana. Yes, ma'am.
As more cases or more people are being tested, you guys expect more cases here in Louisiana?
Yeah, well, that seems to be what's happening around the country and other states. Once they get their first one, they typically get another one and so forth. And we don't have any reason to believe that that's not going to be the case here in Louisiana. But that's why it's important that people take the precautions that we're giving them, because we can limit this. But it's going to require everybody doing their part. And so, yeah, it looks as though this is going to continue to get worse for some period of time before it gets better. But how much worse is really dependent upon how many people do the things we're asking them to do. And for those people in the media, that's where you can be especially helpful. Spend as much time talking about the precautions as you do about other things related to the story.
On the subject of precautions, have you started conversations with the House and Senate about what happens if this, in the legislative session, if there is a need to start isolating any legislators, or kind of what happens on how to take precautions? Because, and I ask that because we just got where the Florida House just evacuated because several members of the Florida House had been to the CPAC conference, where people were confirmed to have the COVID-19, and so now people are self-isolated who are legislators.
Yeah, and so we haven't had those conversations yet, but these types of conversations and plans are what we've been talking about with continuity of operations. Which is a big part of what our task force is doing, and we've had continuity of operations plans going back to SARS and MERS and H1N1, and they just have to be updated. And now we need other private sector entities need to do this. What do you do if you have individuals who cannot come to work and so forth? And so we certainly would encourage the House and the Senate to look at this, and as it relates perhaps even to other things that involve their operations.
We're not too given, elbows and fist bumps on the way out. Is that something you're going to recommend for the rest of the...
Yeah, well, as I mentioned, one of the things that, and this is very difficult for me, and I want to tell you because my instinct has been developed over the 53 years I've been alive, and that is to walk up to someone and shake their hand and talk to them. And I have to continually remind myself, and sometimes I am forgetful. But we're asking people to minimize direct personal contact, not just with people you don't know, but it doesn't matter who it is really, in order to minimize the spread, the community spread of this particular virus. And so while it's difficult for me, and I suspect for a lot of people out there, it would be much better if we didn't engage in those typical expressions of friendship and so forth. And, you saw that this weekend playing out at churches across the state of Louisiana as they revised their guidelines about what they're doing as well.
I know you've answered so many questions.
Yeah.
Is the Department of Health or anyone able to tell us how hospitals in New Orleans or Jefferson Parish currently are doing anything different?
Well, I'll ask them to come up and give it a shot.
Sure. Well, as the governor noted, the work of the task force and of the department has been to put out guidelines, not just for hospitals, but for long-term care facilities, businesses, schools. And after that, we're following up with these organizations to make sure that they have continuity of operation plans. I don't know about every specific hospital in New Orleans at this moment, but as the governor also noted, heads of those healthcare institutions are going to be convened at his request this evening to discuss.
Okay. Look, I want to thank y'all for coming out. Obviously, this is a developing story here in Louisiana, around the country, and around the world. It's something we need to take seriously, but timely dissemination of factual information and having individuals take the precautions that have been put out by the CDC and echoed here in the state of Louisiana is that's the most important thing that we can do at this time. As we have more information, we will be quick to share it with you. That is a commitment that I'm making with you in this room and to the people of Louisiana today. So thank you so much.
With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.